So we've just finished week 9 of the mentorship, which is basically looking at the lower limb kind of pathologies, looking at how you rehab them and how you do specific assessments, say for like the ankle. I did enjoy it, although I did find it a little bit confusing. So I was kind of stuck between, is it an assessment video or is it a video where I'm going to get the rehab for it? There's a lot of different kind of pathologies as well that we're looking at as well. So it's quite difficult to kind of get your head around everything. So you've just got to remember to basically kind of refer back to the basics and the foundations of the mentorship that we got given right at the beginning, and just keep making sure that you refer back to it and you keep going over that. So yeah, I'm just starting week 10 now, so this is basically like a carry on from the previous week. Apart from this time it's more based on the upper limb. I'm a little bit more apprehensive about this because my upper limb knowledge is not so strong compared to the lower limb. Same as I said before with week 9 is that you've just got to keep remembering to refer back to the basics and the foundations of the stuff that we learned at the beginning of the mentorship. Now I did just say off camera as well that I've kind of reached a bit of a point now where I've got all of this knowledge in my head, and it's just a case of being able to utilise that and use that with my patients. So because I've not been that busy in the clinic, I've not been able to put the knowledge that we've done in the mentorship to practice. So I'm quite excited to be able to keep incorporating it and doing as much as I can with the stuff that we're learning as well.
So module 10 now, it's just really taking a lot of the upper limb stuff and being able to apply that to specific cases. So one of the big things from module 10 at the moment is, and one thing that we're talking a lot about in the Facebook group, is post-surgery. So obviously if someone's coming to you post-surgery, they've probably been referred by a consultant, they've probably got a protocol that they need to follow. And what can you do while following that protocol to still progress the patient? And that can be a little bit tricky sometimes, because sometimes, you know, especially if it's something like a distal biceps tendon reattachment or something like that, where they might be non-loading for, you know, 6 weeks, 8 weeks, whatever the surgeon is kind of identified. Now, I'd always respect the surgeon's protocol, but obviously if we're trying to go through our progressions from like range of motions to isometrics to stuffs on the wall and etc., we're not going to be able to progress very, very quickly if we need to follow the protocol or we're not able to load for the first few sessions. But there's still a lot of things that we can do at this level when we're not able to load the patient. So while I wouldn't be progressing them maybe up to the wall stuff or the all fours stuff, we can still do a lot of gentle isometrics, say through the fingertips, even while they're still in the sling. So there's some things that we can do to hopefully increase a little bit of load tolerance. And obviously, if we're going to be pressing through the fingertips, let's say it was a biceps reattachment, if we're pressing up through the fingertips, we're going to get a lot of forearm flexors there. We're going to get a lot of the palmar fascia. We're going to get a lot of these tissues loading. And if we can get these doing their job very well, that's going to help take some pressure away from the biceps tendon as well, while also putting a little bit of load through it. So while I appreciate if we do some isometrics through the fingertips, we're going to get some load through the biceps. It's not going to be isolated load. There's going to be a lot of synergistic work being done at the biceps, which can help us then if we do a good job with those in the early stages. When we do get to the stage that we can load them, we're not starting from square one. So we're giving them a good bit of awareness. We're starting to stimulate those tissues, get them used to tolerating a little bit of load, and normally we can progress them quite quickly. Now, if we can get the range of motion back and we can get them working well isometrically, by the time they go for surgical review, hopefully they should be progressing pretty well, and then the surgeon might let them load a little bit earlier and we can kind of progress from there. Does that kind of make sense there? Yeah, so I think the big thing, and the big thing for module 10 in general, whether it's post-surgery or whether it's another upper limb case like tennis elbow, golfer's elbow, the system's the exact same. So the things that you might be doing in the early stages in terms of restoring the range of motion, the tissues you might be treating in terms of getting the isometrics kind of nailed down, those might be different, obviously, depending on the presentation. But then when I'm going through my progressions are going to be very similar. And that can be a little bit tricky to wrap your head around at the start. It's like, why are you going to do the same progressions for a shoulder pain patient that you would an elbow pain patient? But obviously your cues are going to be slightly different, and the stuff that you're going to do beforehand is going to be very, very different. So I'm going to have to desensitize different tissues. But at the end of the day, if I want someone to get back into the gym, they need to be able to tolerate load, they need to be able to tolerate speed, they need to be able to tolerate impact. So my progressions might be very, very similar, but it's just what we do in the early stages. Does that kind of make sense?
If they've been given 6 weeks before they can start loading up, would you just spend 6 weeks at this?
Yeah, exactly. Yeah. So unless now, if they were making really, really good progress, I might push them a little bit, but I'll be liaising with the surgeon with that as well. So I'll be sending a letter to the consultant or trying to get in contact with the consultant, or if they had a review with the consultant, I'll be asking them to ask the consultant if we're ready to start loading yet. But if not, exactly. I'd be doing a lot of soft tissue work at this point, I'll be doing a lot of gentle isometrics, and I'll be treating clinically as well. I mean, at the end of the day, if we got full range of motion back, there's no pain, they're not getting any symptoms now, they're progressing well, and they're ready to go to the next stage, then definitely. But I'd always, if they've been given a set protocol, I'd respect the surgeon's protocol, but still I'll be doing all I can at this point to help me when I do get to 6 weeks time and I'm able to start progressing them at load here.
Yeah.